Squamous epithelium had the yellow color. In the beginning of the life of the female, now we can talk about colon epithelium take the biggest part of the cervix. And inside the vagina, I believe that you understand that it's a vagina, we can find colon epithelium at the surface of the cervix. After the starting of the puberty, we can expect that the columnar epithelium should go inside the cervical canal, because squamous epithelium is the epithelium who can protect colon epithelium against different affecting moments. And all reproductive age, that epithelium should be inside cervical canal. After the starting of menopause, colon epithelium can get resorption and could be conditioned when we can't find colon epithelium at all. And squamous epithelium will be everywhere. What does it mean? Take a look for the histological structure. Histological structure is here. And you can find the thickness of the squamous epithelium of this picture and thickness of the columnar epithelium. Take a look for the difference. And I believe that you understand that squamous epithelium can protect female against different active and negative conditions, situations in the life of the female. And the most dangerous place is the place which had the name transformation zone. Transformation zone. T-zone, we cannot name it. Transformational zone, different names you can have. But the area of the cervix between the old and new squamous columnar epithelium. The place where one epithelium goes to another one. And that place is most dangerous place in a female organism if we talk about pathology of the cervix, especially about the malignant disorders of the cervix. Memorize it. How to find that zone? We can use specific maneuver. That maneuver has the name colposcopy. It's just visualization with a specific machine of the place inside the vagina to check the condition of that cervix. How to do it? We need to use special colposcope. What is it? It's just microscope who can permit enlargement of our vision. And we can find all zones inside the surface of the cervix. Inspection of the cervix with a low power microscope, magnify the cervix in 420 times. No, we need to do it with help of the speculums. With just the speculums, we need to put it inside the vagina, open the cervix, and find condition of the vaginal part of the cervix. Don't forget, guys, that we are talking about the vaginal part of the cervix. Vaginal. We can check abdominal part of the cervix, but actually, don't forget that we don't need it. Most dangerous zone is here, inside the vagina, in a place where one epithelium goes to another one. And that is why colposcopy is the one of the important maneuver in our practice. And that is why I believe that better for you to see video about colposcopy. And I'm gonna show it to you. I'm gonna show it to you.
Today we'll talk about colposcopy. We'll learn the basics of the colposcopy procedure, understand indication for colposcopy, differentiate normal
from abnormal cervical finding in the colposcopy, recognize common colposcopy patterns. Colposcopy is the examination of the cervix, vagina, and vulva using a colposcope, which is stereoscope that provide light and magnification. The purpose from the colposcopy to identify abnormal area for biopsy. It is a pattern recognition skills and usually done in outpatient setting. Colposcopy helps to visualize the cervix, vagina, vulva, and perineal area. Identify the squamo-columnar junction and transformation zone. Identify and assess size, shape, contour, location, and extent of the neoplastic lesion. Sample the endocervical canal, unless the patient is pregnant. Identify and biopsy most severe lesions. Correlate the pap smear, biopsy, and colposcopic impression. Plan appropriate therapy. Communicate finding to the patient. Indication for colposcopy is to evaluate abnormal cervical cytology screening results, presence of oncogenic types of HPV, follow-up of previous cervical treatment, and for more information about the indication of colposcopy, follow 2012 American Society for Colposcopy and Cervical Pathology. Here is some indication for colposcopy if the patient is more than 30 years old or more and cytology is unsatisfactory, but she has HPV positive. You can perform colposcopy. There is too many other indications to perform colposcopy. Now we'll identify normal colposcopic finding. During the colposcopic exam, you should be able to see squamous epithelium, the columnar epithelium, and squamocolumnar junction. Squamous metaplasia is a normal transformation of columnar epithelium into mature squamous epithelium. Usually appear as a ghost white film when acetic acid is applied. Nabusian cyst, very common finding, and it is normal. Here is some of the abnormal colposcopic finding. Aceto-white epithelium. Epithelium that transiently whitens after application of acetic acid. The white staining fades within few minutes. The more abnormal the changes, the more quickly they will turn white. The more dense they will be, and the longer they will last. There is two types of punctation, fine and coarse. Fine punctation can occur in a variety of conditions, including immature metaplasia, congenital transformation zone, infection, low-grade lesion like CIN1. Coarse punctation usually indicate a high-grade lesion, or CIN2, 3, possibly early invasion. Mosaicism may occur in either a normal pattern or an abnormal modification of pre-existing normal vascular architecture. The etiology of punctation and mosaic are similar. Atypical vessels are superficial vessels that exhibit bizarre variation in diameter, course, spacing, branching, pattern when compared with normal blood vessels. Often appear as a commas or spaghetti-like shapes. They are seen in cancer and occasionally in advanced dysplasia. Leukoplakia, most commonly regions of leukoplakia are associated with an increase in the amount of keratin at the surface of the epithelium, hyperkeratosis. However, not all leukoplakias demonstrate benign hyperkeratosis. Some represent neoplastic process. Polyp occur during reproductive years, especially after age 40. Etiology is unknown. Chronic inflammation of the cervical canal may play a role, as may hormonal factors. Condylomata, valvular, perineal, and anogenital warts are frequently associated with vaginal and cervical lesions. Single or multiple condylomata acuminata due to HPV infection may be visible grossly and are asymptomatic. This picture presents cervical cancer. Now we'll identify the reasons for unsatisfactory colposcopy. If the entire squamocolumnar junction or limits of all lesions can't be completely visualized, severe inflammation or severe atrophy, cervix not visible, entire lesion not seen, most advanced lesion not sampled. Guidelines to help ensure sampling. After the application of acetic acid to estrogenized tissue, this plastic epithelium typically turns whiter than the surrounding normal epithelium. More advanced dysplasia typically appear more densely white, thicker, smoother, with raised borders. The surface of advanced dysplasia often become rougher or thicker as the severity of dysplasia advances. After the application of Lugol solution to estrogenized tissue, there is an immediate blackening of normal epithelium. Abnormal dysplastic tissue is not stained by iodine, which is Lugol's negative epithelium, and remain white or faint yellow. Squamous metaplasia, a normal finding, may appear slightly acete-white and may take up lugal solution incompletely. Therefore, this tissue can cause some degree of confusion. Contraindications to perform colposcopy. There is no absolute contraindication. Some of the relative contraindication including active inflammatory cervicitis, uncooperative patient, heavy menses. Patient education. Discuss the indication of colposcopy with the patient. Instruct the patient to continue contraception practice. Explain that a pregnancy test may be performed at the day of the procedure if pregnancy is a possibility. Instruct the patient to consume a regular diet in the day of the procedure. Advise against taking aspirin or medication containing aspirin for 7 days before the procedure. Review past medical history, including DES exposure, asthma, diabetes, bleeding disorder, and BID. Explain that the procedure will take 20 to 30 minutes. Establish consent for taking a picture. Review the risk. Explain that colposcopy, not a therapeutic procedure. Discuss treatment options. Subacute bacterial endocarditis prophylaxis is not necessary. Equipment and supplies. Colposcope, which is a portable stereoscope with focal distance that allows examination of genitalia and the cervix. Endocervical curette to perform ECC, endocervical speculum, ring forceps, tisular biopsy forceps, vaginal speculum, tenaculum, vaginal wall retractor, acetic acid solution 3% to 5%, and Monsell solution. Here's the procedure. The procedure starts with applying acetic acid solution. We apply it with 2 ways, either ring forceps, or we can also use the Q-tip, big Q-tip for soaked with acetic acid. We apply it to the cervix for a couple of seconds. And then we take it off. Look by the colposcope to identify any abnormal lesion. Abnormal lesion usually turn acete-white or white lesion, and the more abnormal it is, the darker white will be. You can change the light from the white to green light to show the abnormal lesion more clearly. Then after identifying the abnormal lesion, we'll do ECC and we'll take a biopsy. For the ECC, we go with a circular motion inside the cervix, just like that. After we take the ECC sample, we hand it to the MAs, and then we'll take the remaining cells with a cyto brush. Then we'll take a biopsy. First, identify where is the lesion and what clot, and then we can start with the first one. ECC need to be in a separate container than each biopsy. And each biopsy, it's better to be in different containers. So if I'm taking at 1 o'clock, go here and close it. Once we take a biopsy, we don't open the treasure and just keep it closed and give it to the MAs. And we go for the next lesion or the next biopsy. We can handle the ECC, we can hold the treasure upside down like that and take a biopsy. This 5 o'clock and put it in a different container. After taking the biopsies and ECC, we can use 2 things. Monsell solution, which is mustard color solution. This is usually used for heavy bleeding, to stop the heavy bleeding. If the bleeding was not that heavy, we can also use silver nitrate. Then after the bleeding stopped, we take off the speculum. After the procedure, you will be required to fill out the form that include colposcopic finding and the sites of the biopsy. Here are some common errors: losing track of patients who have abnormal pap smear, finding abnormal appearing cervix on inspection when obtaining a pap smear, but then relying on the pap results to determine if the colposcopy is needed, omitting the ACC in patients whom cervical ablation treatment may be an option, failing to inspect the vulva, cervical pharynxes, and vagina during colposcopy, performing too few biopsies, canceling colposcopy in women who are having routine menses, failing to take the time to address all the emotional issues surrounding HPV and other STDs and condylomata, abnormal pap smear concern, putting biopsies in separate formalin containers. This usually is not necessary. Complication from the colposcopy procedure, including bleeding. Infection is rare but typically occur in the third or fourth day. Potential risk that the most advanced cervical disease may be missed by colposcopists or by histologists. Vaginal discharge that often look like coffee grounds typically last for 1 to 2 days and diminish with time. Pain and discomfort, rarely vasovagal reaction. Post-procedure patient education. Agree on a time to discuss and interpret biopsy finding. Explain that mild vaginal discharge may occur. Patient may have spotting for at least 48 hours. Instruct the patient to report passage of clots, onset of fresh profuse bleeding, foul vaginal odor, fever, or pelvic pain. Encourage the patient to continue contraception. Emphasize the importance of returning for definitive therapy. Interpretation of the results. Same pathologist should interpret both cytology and histology results for a given patient. More advanced lesion on the biopsy compared with the pap smear is common and acceptable. For example, if the pap smear shows CIN2 and biopsy shows CIN3. Clinician is advised not to freeze or ablate any cervix until the discrepancy between the histology and cytology has been explained. This concludes our colposcopy review. Thanks for your time.
So that small machine was big story in the history of the medicine. It was the first step for the prevention of different pathology, which could be found in the case if we talk about pathology of the cervix. But during colposcopy, we can use such small maneuvers like, for example, acetic acid wash probe. We can use that maneuver without colposcopy, actually, guys. And if you're gonna work in our specialty, don't forget that using of such fluid like acetic acid can help you. What you need for that? What do you need to do? You need to wash just cervix during your speculum examination with help of that acid. And that's all. Different types of epithelium should formate different colorization, should take different concentration of that acid, and like the result, we will see with you different spots with the abnormal concentration of the acid inside. It will be enough for you to understand that we have pathology at the surface of the cervix, and we can find that pathology in the future with help of our future maneuvers. So you can use another probe, iodine probe, Lugol's solution probe, Schiller's solution test, different names of that. Same story like in case if we use acetic acid. we can wash that cervix during speculum or colposcopical examination with help of iodinum. It will get, I'm talking about the cervix, different concentration of that iodinum, and it will be enough for you to understand had the cervix pathological places or not. And that maneuvers very simple, and we don't need to be afraid to use that maneuvers during our routine gynecological examination. And if you are talking about the prevention of different pathological conditions with the cervix, don't forget that everything in the hands of the doctors. Usually, main story about the benign or malignant node of the cervix are the stories about the absence of the small steps for investigation during routine speculum examination. We can use it. It will help to us. It will be good screening maneuver to get more information. No, during colposcopy, we can use modern technologies like color filters, for example. Different filters for the color can show different epithelium at the surface of the cervix. No, sometimes. After the finishing of the colposcopy, we need to formate conclusion, and it will be enough for us to find different spots at the surface of the cervix, and enough for us to talk about the stories in the future and about the difference during our treatment. How to do it, you see the picture. And now small information about different disorders. First that we need to most often meeting type, most common type of the disorder is just inflammatory. We was touching that story during our PID lecture, and I said that understanding of the infection means that inflammatory process is the process which will start from vagina, and the second step of the development of the inflammatory is the cervix. What inflammatory that inside the cervix can show the story about the can be found with help of our investigation. How it looks like? It looks like just inflammatory, guys. Ruba, color, and discharge. That's all. Just increasing of the color of the red color of the cervix can be enough to tell that the cervix has the inflammation. And what kinds of troubles can be done? Can be infection, can be abnormal biocyanosis of the vagina. It will be enough for the abnormal microflora inside, and like the result, the cervix could be with inflammatory process. How we need to do it? Infections. Infections, different microflora could be meted. Take a look for that picture. Purulent secretion. Usually, in 60% of cases, tell us that female has chlamydia. Could be gonorrhea, could be trichomoniasis, and in other disorders. Or three main signs: color, inflammatory edema of the cervix, and discharge outside. It will be not blood, it will be not pus, it could be just cirrhosis or pleural discharge outside. It will be enough for us, and we need to exclude the presence of the inflammation with help of future our diagnostic maneuvers. What kinds of maneuvers? Of course, smears we need to take. Of course, we need to exclude presence of the infection with help of bacteriological investigation, and treatment should be in accordance with our finding. If we got information about that the chlamydia presence, we need to treat chlamydiosis. If gonorrhea, we need to treat gonorrhea. If trichomoniasis, we need to treat trichomoniasis. Treatment could be with help of local methods and with help of general methods. During the treatment, we can stop sexual activity for the female, or should be prevention of the spreading of the infection with help of barrier methods of contraception. No, it's nothing actually. It's not very difficult to talk about infections of the cervix, because usually, it's a symptomatic story. and usually the discharge is just a finding during routine examination. It looks like that. But if you're talking about discharge, just discharge outside. Sometimes female think that it's normal story. No, just or to believe that usually we can meet such patients which tell, no, I have nothing. She will be without pain syndrome because cervix is the part of the female organism without pain receptors. It will be without pressure because inside the cervix we can find the pressure receptors. But discharge will be, and it will be the one complaint that can be in a case if female has cervicitis. One more time. Normal vaginal part of the cervix, abnormal with the discharge at the surface. Here you can make a print of screen for the probably treatment in accordance with the type of the microorganism. One more time, in 60% of cases we can meet chlamydia, but it could be gonorrhea, trichomoniasis, or another type of microorganism. No, herpes, for example. Okay. Okay. Так, most common disorder which could be meted during colposcopy. Absolutely normal condition, actually. But we name it ectopia. The old name of that disorder is erosion. What is it? Guys, it's just dystopia of column epithelium outside. One more time, column epithelium should be inside the cervical canal. One more time, should be like that. Absence of column epithelium at the surface. Column epithelium should be inside external of the cervix. If you see during your maneuver such picture, it means that column epithelium goes outside and squamous epithelium didn't cover that epithelium yet. Is it normal condition or pathological? No, different articles tell different information. For the present day, we talk that it's absolutely normal condition. For old articles, we had another information. Previously, we had information that after 21 years old, we need to treat it. Last 5 years, we had information that after 25 years old, we need to treat it. For the present day, we have the information that we don't need to treat it. We just need to watch for that. Why that story is important? Да? Because actually, we are talking about just abnormal position of the epithelium. That epithelium is at the surface of the cervix, but should be inside the cervical canal. It's just ectopia, just epithelialization with help of squamous epithelium wasn't finished. And maybe it's just a moment in a life for the concrete female. We don't know. But we have a trouble here. Colon epithelium, you saw the picture, thickness of the epithelium very small. And that condition is very dangerous for the future troubles, because traumatization for that epithelium could be very fast and only be doing. And contact with the abnormal microflora can formate the future serious trouble for the female. I said the transformation zone is the most dangerous place. And in case if female has such story that you see in the picture, transformation zone is here, but should be one more time inside the cervical canal, inside. And contact of that zone are bigger than in normal. And like the result, chances for the cancer or the contact with the premalignant infection agents will be higher. And all of you need to memorize. We need to watch for that for the present day, guys. We don't need to treat, but make a choice what you're gonna do. It's your life, the life of your relatives around of you. And if somebody around of you has that story, you need to be ready to treat it, and you need to be ready to hear such point of view from different gynecologists. I said that usually, no, we have different questions about the story. Next story, да? Atypia. Atypia. Well, take a look. It's a dangerous story. Dangerous story. Да? What you see, да, at this picture, color, which you can find with help of our colposcopy. And that atypia means that inside the nucleus, we have atypical genetic materials. That atypia could be reactive, like the result of the inflammatory process, could be reactive, just place without explaining. But that atypia has specific structure inside. It looks like white epithelium at the surface of the cervix, and that atypia should be treated anyway. One more time, we can't find it, guys, without colposcopy or without speculum examination. All the disorders will be asymptomatic. All the disorders will tell nothing for clinical picture. And during colposcopy, we can find that or another pathological condition of the vaginal part of the cervix. Now you see the picture for atypia at the surface of the cervix, atypical epithelium. Hyperkeratosis could be hyperkeratosis. No, in the place where thickness of the squamous epithelium bigger than normal. Да? And we have another name for hyperkeratosis, leukoplakia. But that story should be treated too, because we have big difference why female got ectopia, да, and hyperkeratosis. Difference is inside the location. Да? Typical place for the ectopia is around of the external os. Place for atypia and place for leukoplakia or hyperkeratosis, no, could be different. Could be different places. Could be here, here, and here. It can be ectopia. And chances for the epithelialization for hyperkeratosis or atypia is 0. That is why abnormal location of such epithelium, like you see at this picture, means that it's not ectopia and it should be treated. What else can be? Could be endocervical polyps. Now, we are talking about the condition. We are talking about the condition with hyperproliferative with the hyperproliferative production of the cells inside the cervical canal. We have possibility to get, I mean, humanity, have the possibility to get polyps everywhere. Could be polyps of gastrointestinal tract, could be polyps of the stomach, could be polyps of the rectum, could be polyps of the endometrium. Same story with the cervical canal. Could be just proliferation of the epithelium inside with the formation of the spheres, specific type of the hyperproliferative complex of mass. Formation of the mass means had the name polyp. What we need to do, of course, polyp is the indication for the removal of the polyp. What kinds of polyps can be? Without histological examination, we can't find it. And in that case, if you see polyp, you need to remove it. And only after that, you can find the final diagnosis. Could be vascular, could be pseudo-decidal, could be typical cervical mucosal polyp. Inflammatory polyp could be, fibrous polyp can be. Could be different types of the polyp, but anyway, treatment of the polyp only operative, only operative. It looks like that. Don't forget that cervix and then and that cervix or canal inside the cervix. It looks like growth which goes outside. How can we find it, guys? One more time. Signs? No, nothing. Only with help of specific colposcopic examination. It will be without spotting, it will be without bleeding, it will be without pain. Asymptomatic, don't forget. Asymptomatic. Sometimes, very rare, it can formate spotting outside from the vagina, but usually not. Usually not. One more time, then. Colposcopic picture, polyp at the surface of the exit cervix. Removal, then. Now, in the ambulance procedure, we don't need nothing, forceps or maybe coagulator. We can remove it with help of another instruments. But anyway, we need to take biopsy. We need to check histological examination. Without removing, we can't find histological structure of the body. What else? There could be such rare meeting condition like leiomyoma. Yeah? I said already that myoma is the benign pathology, benign growth of the smooth muscle. Concentration of the smooth muscle inside the cervix not such serious. And like the result, sometimes we can meet it, but not such often, like in case if we talk about myoma of the uterus. But it can be, and tactic with the myoma for the cervix usually more aggressive, like in case with the myoma of the uterus. I believe that you don't forget that myoma of the uterus is the indication for the watching for that myoma. For the myoma of the cervix, we need to watch for that. Да, it's a normal story. But usually, myoma of the cervix has serious clinical picture. Why? Because pressure, enlargement of the cervix result in the formation of the cervix around of that cervix. Myoma is the not it is a heart muscle, heart organ, heart tumor, and feeling of the pressure is a normal condition in case if female got myoma inside the cervix, inside the cervix. Could be endometriosis of the cervix. We had the lecture about endometriosis and theory of the retrograde passage of the blood, like the main theory for the formation of the endometriosis, can tell that ectopia of the endometrium could be inside the cervix too. And during menstruation, some glands of the endometrium can find new place for the growth, and that place can be cervix. And the typical story is to find that ectopia during our colposcopy. During our colposcopy. It looks like that, guys. Very difficult to find. Take a look. Cervix, external os, and specific spots. What kinds of signs will be? Nothing. It can be spotting before menstruation and during menstruation. How can we find it during our investigation? Nothing. Pain receptors inside the cervix are absent. Pressure receptors are absent. All the disorders that we discussed with you will be asymptomatic, guys. Asymptomatic. What such many disorders I named already. All of them will be without symptoms. That play a role, I mean that information play a role if you are talking about cancer of the cervix. Same story. Same story. Now take a look for the background for the cancer. Each year about 11,000 women in United States learn that they have cancer of the cervix. Try to measure. And numbers of the persons who died, because of cancer of the cervix in US. You see the picture. It takes several years to happen, but can also happen in a very short period of the time. And what is it? Abnormal cells that got abnormal splitting. Like the result we will get with new cancer. But take a look for the global cervical cancer statistics in 2018. And you will see the serious difference between different cancers, between different countries. Take a look for example, African countries. And take a look for the Western Asia. Why, guys? Why? No, everything in, no, take a look in 10 times different. Western Asia and Africa. We're gonna explain it. We're gonna explain it. We have serious risk factors for the cancer of the cervix. It really has serious relationship with sexual intercourse. Many partners, frequent intercourses, early starting of the sexual life, first pregnancy in teenage years, and so on and so forth. But it goes through the contact with the specific microorganism, specific virus. And that virus has the name human papillomavirus. Yes, we have over 100 types of human papillomaviruses. But only 15, 20 of them can cause cancers. Human papillomavirus are very common. Very common. And chances to get that virus during the life close to 100%. And don't forget that information that I said already. We have benign pathologies. And that benign pathologies are nothing without HPV. But chances to get activity of HPV inside normal cervix actually close to zero. Inside the cervix with benign pathologies, of course, higher. What for we need to know about benign pathologies? Because HPV can come inside and find the place where it will get growth. That's why we need to be with serious assurance that our cervix is normal. It was recognized from 1996, and only 25 years we know information that human papillomavirus plays serious role. And after recognizing, we got normalization of the situation with cancer of the cervix in the world. You think that picture tell something about medical help in these countries? Yes, tell. That countries who are here can work with that information. They found the way outside from the trouble with the cancer of the cervix. That countries in the upper part of that picture didn't find how to work with that information. We know the relationship, what now memorize. Most dangerous types, 16, 18, no, 31, 33, 35, and so on and so forth. That viruses play a role not only in the formation of the cancer of the cervix, that viruses play a role in the formation of the oncological disorders of another location. For example, cancer of the gastrointestinal tract, penis, vulva, throat, mouth, what all the organs can be affected by HPV. But cancer of the cervix has 100% of chances to be associated with HPV. Sexually transmitted, usually no symptoms, and symptoms should start only after the formation of the organic trouble. And organic trouble, in case with cancer of the cervix, will be too late. So HPV goes to the cancer. And summary of HPV, you see the picture. So what else can play a role in the formation of HPV infection in our organs? Smoking, other immune system defects, pregnancy, oral contraceptive use. What else you need to know? You need to know that we have good methods for checking of the cervix, not only colposcopy. I said that we need to take smears. Specific smear is the pap smear. Such big scientists founded Papa Nikolaou from Greece. He found possibility to take smear and check it with help of cytological examination. And he found that special brush to take that smears. And with help of that smears, we can exclude oncological disorder with chances 99.9%. How to do it? We need to take that brush, take the smear outside from the cervical canal and from the dangerous places which we found with help of our colposcopy, and check for the cellular structure. What we can find different pictures, like you see it here. We have liquid pap test, we have non-liquid pap test, different pap tests, but results you see. Значит, one more thing that you need to memorize, guys. Cancer of the cervix should start from dysplasia. Dysplasia. Don't forget that we have two different words, metaplasia and dysplasia. Dysplasia is the abnormal epithelium cells that fail to mature. Metaplasia, change of epithelium from one cell to another one. That's why metaplasia is the normal condition. Dysplasia is a pathological condition. And specific story is the cervical intraepithelial neoplasia. The name of dysplasia is the old name. For the present day, we talk about intraepithelial neoplasia. And neoplasia is the very dangerous condition, actually. Is the most serious precancerous condition. They could be low graduate and high graduate. You can see at this picture. Difference is not very serious. Difference means just concentration of that cells and relationship with the basal membrane of the cervix. In the epithelium, here we have stroma of the cervix. And final step of the development of the dysplasia is the breaking of the barrier. At that moment, we can talk about formation of the invasion by the cancer. Until that moment, we can talk about dysplasia. That's why difference is not very serious. So dysplasia is the serious condition which can result in invasion. And after starting the invasion, we can talk about cancer of the cell. One more picture for that. Take a look, CIN, guys, CIN. C-I-N, cervical intraepithelial neoplasia. Memorize that words. Not one more picture. One more picture. All that steps of the development could be excluded with help of pap tests. We can take with help of specific brush that epithelium and find cytological examination and prevent formation of the invasion, because that way take a time. Not like that, no? Like that. One more time. Can we find the symptoms of that story? No. Asymptomatic. Absence of the pain, absence of the pressure. Sometimes can be discharged. Sometimes can be spots. But forget about it. Memorize. Asymptomatic. Asymptomatic. That is why you need to know about colposcopy and about tests during speculum examination. If we got with you carcinoma, we will see with you same picture. Why? Because take a look for the stages, guys. Carcinoma in situ, stage 1, stage 0. It can be not more than 5 millimeters. Try to imagine 5 millimeters. Will it result in a bleeding or pain? Of course not. In a case when we talk about stage 1, take a look for the picture. Not more than 7 millimeters. Not more than 7 millimeters. Absent of the symptoms, guys. Absent. Only if you have stage 2, when that cancer got the spreading at the surface of the vagina, we will see with you rupture of the connections between the cells, and female can get first clinical sign to you. First clinical sign will be bleeding. Before that, signs will be absent. In case when we talk about stage 2, we will see that it will be big structure, big growth, and so on and so forth. But in the beginning, it will be small structure with a small growth. And stage 2 is it too late for us. Stage 3 means the trouble with the spreading at the another organs and systems, specifically pelvic wall, ureter, and bladder. Stage 4, far metastasis, bones, lungs, livers, distant lymphatic nodes. And don't forget that everything could be stopped in that moment, just with help of good watching. Don't forget what for was made: colposcopy, functional tests, iodinum, pre-malignant disorders, predisposing factors, Papa Nicolau test, just for prevention of that story, development of cervical cancer. Take a look for the survivors rates. Stage 2 has 5 years surviving only in 40, 60, or 30, 40%. So after 5 years of our treatment, we can expect that only 5 persons from 10 will be alive. We are not talking about 10 years surviving. So 5 from 10 gonna die. In a case if female got first clinical sign, like discharge. One more time. At that case, 7 millimeters, will be nothing with that person. Nothing. Discharge mean that chances to be alive 50. How to treat, guys? No, of course, surgical treatment. Surgical treatment. If the surgery, we didn't know. In stage 0 only, we can talk for organ keeping operation, in stage 1, and later we need to remove everything. Hysterectomy with adnexa to stop the spreading of the possible metastasis. Radiotherapy could be doing, chemotherapy could be doing. How to prevent it? How to prevent it? No, we have the point where we need to put our eyes. That point is what? HPV infection. And for the present day, we have HPV vaccine. And that countries who had the normal situation with the cancer, believe me, they don't talk about good watching or something else. They made government programs for vaccination. And all of us need to understand that vaccination against HPV is the good story, good thing. And we need to do it. I can recommend it to all of you. No, main trouble with the age. Age should be less than 21. Somewhere they made until 25, but best age is until actually 15, before starting of sexual life. No, take a look. We have recommendations for the present day, 9 till 26. No, somewhere we got bad results in a big age vaccination group, somewhere good results. Women after 26 we can't recommend. Pregnant woman, of course, breastfeeding woman we can't recommend. No, guys, that's all that I was trying to tell you. Screening, good work for the gynecologist in all world, and vaccination can prevent cancer of the cervix. And you saw it in the picture in the beginning of my lecture, in the middle of my lecture about cancer of the cervix. So thank you very much for your attention. You can begin. Thanks.